Does this have a voice?
Take that seat. Did you pass off of that?
Okay. Hello?
Hi, this is get ready to start in a minute here.
Okay, no worries.
Hi, this is CCHP. We just want to check, does everybody see the picture up on the screen right now?
Mine just says CG.
Okay, we'll work on that real quick here. Hi there, this is CCHP again. Does everyone see the screen now?
Yes.
Great. Well, just give us another minute, just let people keep logged on, and we'll start.
Hi, this is Christy from CCHP. We're going to go around the room and just introduce ourselves. So if you have any questions, you'll know who's in the room. If you have any particular questions, feel free to, we'll give answers at the end of the presentation too, or you can type them in the chat. So I'm Christy, I'm CCHP Provider Communications.
Diane Schneider, Provider Relations.
Lydia Zeller from Kiio.
Tina Meredith, Project Manager.
Mike O'Leary, the Manager of Behavioral Health.
Daisy Martinez, Provider Relations.
Dawn Rady, Provider Relations. Jamie Heather with the Health Management and Wellness Program.
Tina Pyle in Provider Relations. And I'm Jennifer Munoz, and I'm the Patient Care Coordinator here for Dr. Pierwall.
Hi, Jennifer.
Hi.
think we're going to start. Lydia, want to take over?
Okay, great. Well, thank you all for joining us, and thank you, CCHP, for the opportunity to share a little bit about CCHP's low back pain program that Kiio is partnering with CCHP on, and provide, hopefully answer any of your questions and provide you information about the program. What we've put together is a little bit of an overall introduction, and then a deeper dive into the program itself. We're going to talk about outcomes, a few patient stories. We'll do a quick demo that I videoed of the app that the patients use to engage with the program, so you can get a feel for the patient experience. A little bit about the value proposition, both to practitioners and patients. And then there are a couple processes that you may encounter. One is a medical clearance process, and the second is the process for referring any patients that you feel may be appropriate for this program into the program. So we'll walk through those two processes and then have a Q&A session at the end. So CCHP's low back pain program is a digital therapeutic program specifically to help reduce low back pain for patients with nonspecific mechanical low back pain. It is provided by CCHP free to CCHP members, and this is for both CCHP and Together. The program, at a high level, provides ongoing evidence-based multimodal support. It is an app-based program. It begins with screening, and we'll walk through all of this in more detail, but it begins with a screening where we look at medical risk, behavioral health risk, and gather baselines. For example, the type of back pain, the pain level, and a baseline on a functional activity. And then for those members appropriate for the program, the app guides the patient through an animated series of low-impact exercises designed to help reduce their specific type of back pain, and also delivers pain education materials and contextual messaging. Patients also have access to one-on-one contact with Kiio's professional care managers to answer any program-related questions that they may have. And we'll go through the outcomes later, but Kiio has been shown to significantly reduce pain, improve function, and reduce use of opioids, other prescription medications, and more aggressive diagnostics and treatments. And we'll go through all of that as well. So Kiio is a digital therapeutic, which we hope you will find to be another resource in your toolbox for appropriate patients. So I want to just kind of begin by talking about what we mean by a digital therapeutic and a definition. And essentially, this is using advanced software to deliver care. There are really two pillars to a digital therapeutic. The first is that this is evidence-based medicine, and the second is that it is consumer-centric. And what I mean by consumer-centric is immediate, convenient, easy to use, and personal. So by employing this tool when appropriate, you can improve patient access, improve patient satisfaction, provide a really convenient delivery mechanism for your patients, and have great outcomes. So what do we mean by evidence-based care pathway for mechanical low back pain? When we put the program together, the components from the screening through the actual care delivery are drawn from clinical practice guidelines, including the American College of Physicians, the American Pain Society, and the American Physical Therapy Association. And if you would like more information on the program, you can certainly reach out to me, but we've also put together a much more detailed program description, including the scientific references, and the link to that is on your screen. This meeting is also being recorded, so you'll have access to these slides afterwards as well. So just at a high level, what the member journey for the program is. Step one is that your patient or the CCHP member becomes aware of the program, and they may become aware of it through an awareness campaign materials that we have sent out to them, or they may become aware of it through you. The next step then is that the member registers and then completes a brief online screening, and we'll go into more detail about that later, but we're looking at risk factors, and then we're gathering baselines. And based on that screening, we'll deliver a care program specific to their type of back pain. The third step then is engaging with the digital care program. This will download to your patient's mobile device and then guide the patient through both the exercises and the educational portion of the program. And then the fourth component is data and reporting. So Kiio provides back to CCHP screening results, participation levels, and the impact on patient-reported pain and activity of daily living. So we're going to walk through the four components in a little bit more detail. Kiio has delivered, in collaboration with CCHP, awareness materials to CCHP members who are eligible for the program. So this is available to anyone 19 or older. And what's on your screen here are examples of the materials that your patients may have received. So these include direct mailers, and then when we have email addresses, we've also sent out emails. So when a patient registers for the program, the first step is that they complete an online computer adaptive screening. So this is completed by the CCHP member themselves at their convenience. It takes about 5 to 10 minutes to complete, and we're really looking at four main things here. The first is we're looking at medical risk. So are there any medical red flags that would indicate that the patient really should see their practitioner prior to engaging with the program? And in a later slide, we'll walk through exactly what some of those questions are. The second is a behavioral health risk screen. So we're using a psychosocial risk stratification tool that's been clinically validated specific to back pain to identify the small subset of the population that has developed catastrophizing fears around their ability to recover. We're third looking at the type of back pain because it's important to give different exercises based on the type of back pain, and just a little more detail around that. What we're really looking at is what type of movement is going to exacerbate the pain. And based on that, we will deliver either a mostly flexion-based exercises, mostly extension-based, or non-directional. And then fourth, we're gathering baselines. So a baseline in pain using the 0 through 10 smiley face scale that you're all familiar with. Second, function. So we ask the patient to identify a functional activity that has been both negatively impacted by their pain and also is important to them. And we gather a baseline on that on the same 0 through 10 scale. We then look at history of medical utilization, and we look at the impact, if relevant, that back pain is having on their work. And then at the end of that 5 to 10 minute screening, we run a multidimensional risk profile, and based on that risk profile, either provide the member with their personalized digital care program or refer the member to their practitioner. And again, we'll go through what some of those referrals, the reasons for referral would be. But if a patient comes into you saying that they've been asked to see their practitioner because of this screening, that's what we're talking about here. What we find is that in general, about 80% of individuals who complete the screening are eligible for the Kiio's digital care program, and about 20% are referred to their practitioner. That's going to fluctuate a little bit in population. What we're seeing right now in the early days with CCHP is that the Medicaid population is having a little bit higher referrals. So fewer are eligible or appropriate immediately for the Kiio's care program. So the care delivery itself is app-based and it's multimodal. The first component is exercise. And as I mentioned, this is specific to the type of back pain identified during screening, and then it is also progressive. So there's a progressive series of exercise routines designed to move the patient from gentle range of motion and stretching onto core strength building and on from there. And every member is progressed at their own pace based on their response to the exercises, and we'll talk about that in just a moment. We use interactive digital coaching to guide the member through the exercise portion, and you'll get to see a little bit of that during the demo of the app. The next component is it's essentially pain neuroscience education materials, but written in a very engaging manner. I should mention that the entire program is mostly the 5th grade reading level, certainly 6th grade and below. The education components were written for the program by Dr. Adrian Lau, who's the founder of the International Pain and Spine Institute. He's the you're probably familiar with his in-clinic patient pain education materials. And he wrote these for the program. They're very similar to what you may see in clinic, but they're in bite-sized pieces. And they're delivered to the patient on a varying schedule that looks at both how long it's been since the patient last received the material and how engaged they are. There are articles about, it's mostly reassurance. So the fact that most people are going to experience pain at some point during their life. The best thing that you can do is to stay active, return to work, build activity into your life. There's information about life stressors and activities that will exacerbate pain, tips to mitigate that. There's information about just understanding how your nervous system works and how pain works in your body. There's information about opioids. There's information about advanced imaging and conversations that the patient may want to have with their provider. We use personalization. That would be things such as being able to be notified on whatever time and day you want to do your exercises, setting goals, and the ability to choose whether you want on any given day to do a shorter version of the exercise program or a longer version, depending on how much time you have. We give people views into their progress, and again, little bits of engagement, such as getting your star for the day, completing your ring for the week, et cetera. We intentionally are not using any special hardware or equipment and not requiring any appointments. That's to increase the ease of use. About 9 out of 10 people say that Kiio is easy to use, and that's very intentional on our part. So this is backed by both artificial intelligence and human care management. The AI is what is guiding people through the program. So as your patient engages with the program, we're re-querying things such as pain level, function, and perception of how the patient is doing. And based on that, everyone is going to be progressed at their own individual pace. And the in-app messaging and encouragement is also contextual. So the message received is going to be dependent on what is happening with the individual at that time. The patient is able to engage with the program 24/7. And then there's also access to professional care management by Kiio. So this is not something that you would need to be doing, but the patient always has the ability to have one-on-one contact with care management if they have a question. And then there's also exception-based alerting into care management. So for example, if we do identify a medical risk during the screening, care management will proactively reach out to that individual to see if they have questions. There are warm handoffs and workflows in place with CCHP's care management as well, so that we're really trying to get the best care to that patient. Again, we're tracking every interaction of the patient with the program and then providing reporting back to CCHP. You see up here some example reports showing the percentage of enrollees experiencing reduced pain and then the average reduction in pain. And by that, what we mean is comparing the baseline pain captured during the screening to the most recently reported pain. What we'll typically see is that this is dose dependent, and we'll talk about that a little bit more, but the longer the patient engages with the program and the more levels the patient completes, the better the outcomes are going to be. So the larger the reduction in pain and the larger the improvement in function. The program has 3 core levels of exercise, but is available to the patient for a full year after enrollment, and that's because, as you well know, back pain is very recurrent, so we want the patient to be able to come back when they have a flare-up. So we're shifting now into outcomes and looking at Kiio's overall book of business. And what we are seeing is that 8 out of 10 participants experience a reduction in pain. Again, this is comparing the baseline pain captured during screening to the most recently reported pain through the app. And that the average reduction in pain is 50%. So, if you came in with an 8, now you would be at a 4. If you came in at a 4, now you would be at a 2. That is obviously well in advance of, well in excess of clinical significance, which is either 20 or 30% for back pain, depending on what benchmark you're using. 9 out of 10, whoops, there's a typo on the slide. It's actually 90% on all of these, not 50%, I apologize on that, but 9 out of 10 would recommend to a friend, learn how to better manage their back pain, and say that it's easy to use. I think that the most pertinent of these is learn how to better manage their pain because, as you know, back pain is very recurrent. So the next slide look at, we've done 2 studies with health plan partners looking at the impact on medical utilization in Kiio participants. The first study was with Quartz Health Solutions. As you know, they're Unity, Physicians Plus, and Gunderson. They were our first health plan partner, and they did an implementation in 2017. So this looks at over a year of claims data post-enrollment and also 2 years of claims pre-enrollment. I'll be very clear, these are not formal clinical trials. These were studies, case studies in the health plan population. In the case of Quartz, what they did was identified chronic low back pain sufferers through claims, and those were the individuals invited into this program. And what we found is that specific to prescription medications, Kiio participants filled 79% fewer opioid prescriptions post-enrollment compared to 1% reduction in the reference group. And for non-opioid prescriptions, so prescription NSAIDs, muscle relaxants, anti-anxiety meds, anticonvulsants, we had, excuse me, a 25% decrease in the Kiio group compared to a 23% increase in the reference group. Overall, where we saw the big reductions was in the more aggressive diagnostics and treatments, so specifically MRIs, injections, and urgent care emergency. Our second study was with WA Trust. This was in 2018, and again, looking at a year's worth of claims data post-enrollment, and then in this one, a year's worth of claims data pre-enrollment. And the results were very similar. So decreases in imaging, injections, urgent care, radiofrequency ablation, again, decreases in medication, so benzodiazepine, 66% decrease, a smaller decrease in opioids, 24%. That's mainly because WA Trust had already put in place a number of very successful measures around reducing scripts prior to Kiio, and then had another 24% reduction with Kiio. And there are links on there. At the bottom of the slide, there are links to the case studies. So we have a few member stories that we'd like to share with you. When I speak with members or end users about the program, really there are 2 themes that run through. The first is that the patients appreciate the convenience, so that it's 24/7 available. If you have pain at 2 in the morning on a Saturday, you can use Kiio right then. No special equipment. This does not, by the way, chew up cell data. It can be used offline and then just syncs back up when on Wi-Fi. And all you need is your phone. So that's one theme. And then the other is helping people get back to something that they love doing that was negatively impacted by their pain. And we really, our users run the gamut from younger people to older people. I will actually say that we probably have our best engagement from 45 and up, which is interesting. I often get asked about that. But the people in that 45 to 90 actually engage very well. This first story is Naomi. She's a young mother. She had persistent back pain after having her 3 children. She had been to physical therapy and did improve, but did not get to where she needed. And she also just found it was very difficult to incorporate ongoing appointments in with her busy life that was both a mama life and a working life. And she experienced significant pain reduction with Kiio and uses it on an ongoing basis still. Anne is a very different story, 78-year-old lady. Her passion is sewing, and to sew you have to sit, and she was unable to sew for many years because it was just too painful to sit for any period of time. She actually does Kiio every morning when she wakes up because it gets her loose and she's able to then have her day. She had tried in the past exercise programs, but she really doesn't like having to get in her car and drive into town. She lives out in the country, and so this is something she can do in her own home. Kathy is an executive at a disability company. She had slipped on black ice and injured herself. She did have physical therapy, etc. Again, had improvement, but still had difficulty walking around the block. She has incorporated this into her daily life. Her goal was to do a hiking trip, which she'd enjoyed doing in the past, and she was able to do that this last fall. And Jerry is a gentleman in about his 60s. What he appreciated about the program was the structure, so having the app tell him exactly what he needed to do and how to do it. And he's back to his hobbies, which are photography and fishing. So we're going to do a quick demo here it's always very difficult to demonstrate a dynamic program because all you can see is a snapshot in time, but I'm going to show you a little bit of the app portion of the program that the patient would engage with. What you see first here is just a quick tutorial. This is the very first thing that the patient would see that kind of explains how the program works and encourages people to complete it. The main app view itself is a feed view, so the most recent things are going to come to the top of the feed. And you can see up at the top showing the program progress. So this person's in level 2. We've now started an exercise.
Double knees to chest. Pull both knees to your chest. Keep your back flat. Both. 1 set of 3 reps.
So that was the preview, and they'll count down to begin.
Beginning in 5, 4, 3, 2, 1. Starting exercise 1. Hold.
Males will get a male avatar. Females will get a female avatar.
5, 4, 3, 1. Exercise 1 completed.
This is querying about whether that exercise is helping. And now we're seeing the last exercise in a routine so that you can see the questions regarding pain.
Exercise 8 completed.
So this re-queries on pain and then overall perception. And there's also the ability to reach out to care management there. This shows setting a reminder. This will be a push notification into your phone, and then now that you've set it, that tip goes away. This looks at the knowledge materials. That's probably one of the longer ones. And now we're just going to scroll down so you can see the titles of some of the others. If you have questions on any of this or want examples, please feel free to reach out to me. This is the in-app messaging. So these would be messages that come out to encourage people, set expectations, etc. And this is a view at the report section. So this one looks a little odd since it's my demonstration person, but what you're going to be seeing is their pain over time or their function over time. I think here you're just going to get a view in a second of a questionnaire that looks at that function. So this particular person had picked sleeping through the night as the activity that they were having difficulty with.
Reaching your weekly goal. Keep up the awesome work.
You'll notice that the voice is a little bit stilted sounding. That's something that we've debated back and forth. We're using the native reader because we want people to be able to use it offline. To use the Siri type voice, you have to have a connection, and the members have reported to us enough that they want that ability to use it offline that right now we're sticking with the native reader and hoping it improves. So the overall value that we hope you'll see to patients, and that what we've had people, when we ask people what do you like about this, the 24/7 access, the fact that there's no special equipment needed and no special hardware needed, so we did not, none of the exercises require weights or bands. It's free, so this is being provided by CCHP as a benefit to their members. If you refer a member in, there's no charge to the member. Patients who stick with the program do experience significant pain reduction. It can be used offline. It's easy to follow with the in-app coaching. There's education so that you better understand pain. And with any questions, we do provide human care management to answer questions. As far as value to you, we hope that you will find this a valuable resource to refer patients in when you feel that it is appropriate to provide patients with a very robust program to help them through their back pain, thus increasing patient satisfaction and giving you another ability to help your patients and reduce opioid prescription, which we know we're all trying to do. So now I want to just pause and talk through two different workflows. One is we talked about during screening that a patient may get the message right after screening that based on their screening responses, we suggest you see your healthcare provider, and then they'll get a follow-up from care management with that urging as well. So the reason, again, would be, so your patient may come into you requesting medical clearance. Again, the reason would be that screening identified a potential medical or behavioral health issue, and we'll look at those on the next slide, what those might be. If you have any questions, you can look for information on that URL about the program itself, or you can call Kiio. If you want to know specifically why this patient screened out, we would need a HIPAA release, and then we can provide you with that information. If you feel that the patient is medically appropriate to participate, then you would fax the medical clearance form, which we provide to the member, back to Kiio, and then they would be activated into the program. And again, if you're having conversations with your patients, encouraging them to finish the 3 core levels, that will get them the best benefit. So here are some of the reasons why we might suggest that a patient visit you. One of them is we just ask, has your practitioner told you to avoid gentle exercise? So if the answer is yes, obviously we're not going to provide access to the program without a clearance. The second reason would be a recent injury that has not yet been evaluated by a practitioner. Pregnancy if the woman does not agree to discussing her participation with her practitioner. An unexplained weight loss if the patient does not agree to discussing it with the practitioner. Looking at incontinence, either suddenly developed incontinence or worsening incontinence that the practitioner is not aware of. Numbness, and then inability to walk without dragging the foot or with the foot slapping on the ground. Those are the examples. The other, the behavioral health, it would be somebody who's high risk on the START tool. So the START tool is a clinically validated risk stratification tool for back pain. So then the second workflow is if you have a visit by a patient with back pain and you feel that they are appropriate for the program and this would be a good resource for them. And the workflow for that for you would be to just refer them to the program. CCHP is putting together flyers, so you would be able to hand the patient a flyer, or you could just refer them to the URL where they can register. There's actually 2 different URLs, one for CCHP and one for Together. Then again, encouraging the patients to complete the 3 core levels, and at the same time, faxing the medical clearance, which CCHP will provide to you, to Kiio. This is just in case the patient screens out. Even though you've already determined that they're appropriate to participate. This is sort of a temporary workflow, but we don't want a poor patient experience by you referring them in and then they screen out and then they have to go back to you. That's not a great patient experience. So we're requesting a proactive faxing in of the form. If you have questions on this, or we're developing this process of working with the practitioners, so any feedback on how to make the process more smooth or the program better, we'd love to hear from you. So please don't hesitate to reach out. My contact information is here. This is showing you that kind of the local health plans that are making Kiio available to their members. This is often white labeled. So for example, both Children's and Together, it's called the CCHP Low Back Pain Program. They're all powered by Kiio, but they may have different branding in there. Quartz Health Solutions also offers it to all their members. Their white labeled product is called Mobile Back. WA Trust offers it, Health Tradition offers it, and Group Health Cooperative of South Central. And now we're into Q&A.
Do we have any questions on the phone?
Leticia handed me some questions that people submitted that I could read her answers to.
That would be great. Mike's going to answer some questions that you guys submitted earlier that we have answers for.
All right. Someone asked, will this program replace any coverage for TENS E0730 unit. I don't know what that is, but something does. And Leticia says, no, this will be an additional benefit. Let's see here, somebody asked, how do you process prior authorizations? The answer is just give step-by-step process. Oh, so we're supposed to give. You want to do that, Tom?
No. It doesn't require authorization, so.
Oh, I think that might have been a question just about another prior auth. Is that?
It's possible. This program does not require prior authorization. If you do require prior authorization for another code, another procedure, that's through CareWeb, and we can help you through the portal line if you're having questions about that.
Which is 414-266-5747.
And I think there, just give step-by-step process. Maybe that was what Lydia already went through in terms of referral here. How long does it take? How long it takes to review and approve or /deny?
So if this is for this program, there's no, the patient completes the screening process 5 to 10 minutes, and right at the end, they're either provided access to their program or provided a referral to their practitioner.
And what are criteria a child can be eligible to have a PCW service?
For this program, you would need to be over 19 years old. And if they submit a medical clearance form, how soon does the patient get approved?
It should be within 1 business day. And we will reach out to the patient and you now have access and help them get it on their phone if they need help.
Will this be a part of weaning patients off meds and injections?
So this is, as you can see from the outcomes, been effective at weaning patients off meds and injections. If you have any questions, hopefully the more scientific backings that we provided the URL to will answer them. But yes, this has been effective both in patients who have already gone down the pathway of injections and even surgeries, and also has been effective much higher upstream for patients who are just beginning to be seen for back.
Can the information be accessed to be utilized for procedure authorizations?
Can the providers get access to the patient's information on the app?
So right now we do not have a direct access for the providers. That's something, again, we appreciate your feedback on, whether that's something that would be beneficial to you. If you want access to a particular patient's records, we would just need the HIPAA clearance and then could provide you with that information.
And do we have any other questions on the phone? If not, we'll be emailing this out later today, the video. So if you missed anything, you'll be able to get access to it. And feel free to reply on that email, and we'll get your questions right away, too.
I actually did have a question. I just want to know if this is something that you guys are looking to actually have be required before they would need to submit information for any injections or medications.
At this time, no. It's just an added benefit.
Okay. Thank you.
Mm-hmm. Any other questions? Okay, thank you guys for joining us today, and we'll be sending that out later today. We really appreciate you guys attending. Thank you. Have a good day.
Bye.
Bye. Bye.